is your intravenous therapy station. You may look over your equipment. Time will start when you begin.
Okay, so I have an IV arm. I have the tourniquet for that arm. I have my sharps container, tape in case I need to use the tape. So I want to prep it so that's easy for me to take apart. I have what's called an alligator clip in case I need to administer medication. I have some IV catheters. I have alcohol prep pads. I have a securing device called the Beanie Guard. I have a gauze pad that I can open up, 4x4 pad in case I miss. I have all this equipment. I have my oxygen, I have my IV tubing, and I have an IV drip bag. I have my gloves. I'm ready to begin. BSI scene safe.
Scene safe.
So I go ahead and check my fluids and prepare my IV line. I have a IV fluid, look for date, the type of solution, look for clarity, making sure it's not expired. I have a drip set. This is a macro drip set. So the macro drip set, I would then take off the top and then connect my IV tubing, my drip set here to my IV bag, making sure that I have the clamps cut off so that when I turn it over, the drip chamber does not fill up with fluid until I'm ready to do so. Hang my my IV bag up, pre-fill my drip chamber to an appropriate level, open my clamps, and then go ahead and flush the IV line. Making sure that all the air bubbles are out. Okay. Make my alcohol prep pads. Get my Beanie Guard open. Apply my tourniquet on so I can prepare a site. Tag tails go up. I look for a palpable site. It looks good. Go ahead and wagon wheel. Drop it in the middle. Wagon wheel outwards. I'll take another one. Drop it in the center. Wagon wheel outwards. Make sure that it's totally clean. Let that air dry a little bit. I have the IV and IV catheter. Go ahead and inspect it, burrs, spurs, and shears. Exercise my catheter so that it works clearly. I go ahead and pull tourniquet and traction. I have my IV site. Explain to the patient there's going to be one sharp poke on 3, 1, 2, 3. I see flash. My angle is about between 15 and 30 degrees. I lower the angle. I'll go ahead and insert it a little more, and then I'll thread in my catheter. I should see blood in the chamber and filling up through the catheter. I go ahead and take the tourniquet off, dispose of my sharps. I have control over the insertion site. My finger is not touching the insertion site. I go ahead and run this. It's running wide open. I TKO. I look for any infiltration. Now I can go ahead and tape my site down. Just over the color catheter part. Adjust my flow rate to the TKO, proper flow rate. And then I can clean up my station and prepare for my med administration. In some cases, we can also be able to label our site. by just tearing the tab and then placing this tape over so that they know this is a 20 gauge IV catheter. I'd like to proceed now to the med administration portion.
You may proceed.
Okay, so I have this is another time station. I gotta make sure that my IV site is patent and running. I go ahead and identify my patient, the right patient for the right medication, the right dose, the right route, right time, and right documentation. So there's a lot of rights here. I'm gonna be giving 1 milligram atropine. It's a preload. I pop the tops off, connect the preload, expel any of the air out. I have my drug, right patient. I have my oxygen, my alcohol prep pad, and I have my IV that's running. I'm gonna need to make sure that I put a alligator clip in order for me to attach it, because this is a lure lock and this doesn't connect that way. So I go ahead and place this on, keeping a sterile field. I go ahead and get a alcohol prep pad, prep and clean the site, turn down my IV so that it doesn't flow back upwards when I'm giving the medication, connect up my alligator clip. I can pinch off the tubing so it doesn't go backwards. I'm going to then administer my 1 milligram. 1 milligram of atropine has been given. I would give the entire vial here. This is 1 milligram in 10 cc's of solution. After I give it, I go ahead and make sure that the line is running, and I flush the line. Then I'm looking for my desired effects or any type of side effects or adverse effects that could occur. Then I put my IV flow rate back to a TKO and then monitor my patient. End station.